from the University of Ilorin, Kwara State, Nigeria. I just finished a degree in human anatomy, and yes, I'm actually a neuro neuro anat neuro neuroscience enthusiast. So I was just surfing the internet, then I came to I just saw the notification pop up. I don't know what I clicked actually, but I saw that there's a conference like this coming up, and I'm of the type of person that likes to learn and likes to associate myself with neuroscience neuro practitioners and enthusiasts as well. So that was why I hopped in, and then I saw the opportunity to come and speak. And then there's a topic I had in mind, the one I actually worked on, a literature review I worked on a year ago, sorry, 2 years ago, that's 2021. So that came to me and I was like, okay, this is an opportunity for me to to see what I have, the little I have. So yeah, that's it about me. And today I'm going to be talking on the anatomical basis of antisocial personality disorder. I want to believe I'm audible enough, please. If I'm not, I would like to receive comments concerning that so that I'll know what to do before I start. Please, am I audible enough? Hello, everyone.
Yes, Dr.
Yes,
Okay,
Yes,
thank
Mr.
you.
yes.
Deval.
Okay, thank you very much. So I'm going to start. Anatomical basis of antisocial personality disorder. To tweak the topic a little bit and to suit the aims and objective of this conference, I will be explaining the anatomical basis of antisocial personality disorder by looking at how antisocial personality disorder can be a neurodevelopmental disorder. And at the end of my class, at the end of, I'm actually a teacher, so I'm used to saying at the end of my class, I apologize. At the end of this presentation, I'm going to be explaining the reason why I choose to talk about this topic in a conference like this. There was something behind this topic. So at the end of the class, I'm going to be explaining that. So now, antisocial personality disorder as a neurodevelopmental disorder. To start with, I will use the following outline to explain, and then I will be explaining what neurodevelopmental disorder is all about. That will be very, very short and simple because that is something everybody is aware of. And then next thing, I'll be introducing antisocial personality disorder. Then after the introduction, under the introduction, I will be talking on quite a number of things as well, like the epidemiology and diagnosis and some other things. Then I'll be moving straight down to, after that, I'll be moving straight down to neurological impairment that can be noticed among people suffering from these disorders. And then moving down, after that, I'll be going to explaining genetical basis of antisocial personality disorder and the hormonal changes that can be noticed as well among people with this disorder. Then I'm going to be concluding. So first thing, neurodevelopmental disorder. What exactly are neurodevelopmental disorders? Neurodevelopmental disorders are those disorders that affect the development of our nervous system. I am very sure we are all aware of how the brain, the spinal cord, and all our nerve cells came to formation. Everything started from the third week of gestation, and that is through the formation of neuroectoderm, formation of neural plates, and so on and so forth. So neurodevelopmental disorders are disorders that affect the developmental process of this nervous system, and these disorders causes impairment impairment to the growth and development of the central nervous system. We are well aware of the fact that the timing for the formation of the brain is very, very tight, and any small complication can cause an impairment, and that impairment you have is adverse effects when the baby is ready, like when the baby is finally born and then walking, because that will lead to either an absence or reduction in growth, in structure, or increase in the structure of the affected part. And a lot of things can cause neurodevelopmental disorders. Examples are genetic disorders, immune disorders, nutrition. For example, folic acid is a nutrient that is important for pregnant women to take. So sometimes absence of this nutrient can have its adverse effect in the formation of the brain. An example of a disorder like that is spinal bifida. So uh, physical trauma and so on and so forth. Moving straight down to introduction of antisocial personality disorder. First of all, or to start with, what is personality disorders? Personality disorders are actually those disorders that are characterized by unhealthy pattern of thinking, unhealthy pattern of behaving, and unhealthy pattern of functioning. Now we know how we can relate that definition to antisocial personality disorder. So antisocial personality disorder is a severe personal personality disorder. Sorry, it's a severe personality disorder that is characterized by lack of remorse, consistent irresponsibility, disrespect to lawful behaviors, long-term disregard for human rights, and so on. In short, to cut this short, when we hear about antisocial personality disorder, the first thing or the few things that should come to our mind are individuals that are socially irresponsible, individuals that are that lack remorse, and individuals that I don't want to call it that are like criminals. So these are people that do and undo, and they don't think twice. They don't think twice before they act. They are very, very impulsive. So antisocial personality disorder is among those disorders that were classified that were classified in the diagnostic manual of mental disorders, and they belong to cluster B. We actually have three clusters in the manual. We have cluster A, we have cluster B, and we have cluster C. Antisocial personality disorder belongs to cluster B, together with the likes of borderline personality disorder, narcissistic disorder, and histrionic disorders. So, epidemiology of antisocial disorder. Why is it important to know this? Why is it important to be aware of this disorder? Actually, in my side of the country, this disorder is among one of those disorders that have been underdiagnosed, in the sense that people don't actually really pay attention to this disorder in my side of the country. That is one of the reasons why I had to look at it and do this literature review on it, just to enlighten people about what they have around that they are not paying attention to. So According to Moran, he found out that from his analysis, he got that about 2 to 3% of the samples, around about 2 to 3% of the population of a region in the UK is filled with people with antisocial personality disorder. And then he also found out that about 40 to 60% of criminals that are in jail have these disorders. And then by the ratio of gender, male to female, he found out that the ratio of males with the disorder are actually more than the ratio of females with antisocial personality disorder. So, just like I said, this I can't drop a statistics of it would have been more interesting for me to drop a statistics of my local environment, but the disorder is quite underdiagnosed. Underdiagnosed. A lot of people don't even like really pay attention to it. And although I see like a sign of it every day, almost every time, but then when people don't really know about something, we just feel like it is the normal way of life. So next thing I'll be talking on the neurological impairment that can be noticed among people with this disorder. Different parts of the brain is affected, or different kinds of impairments can be noticed at different regions of the brain of people with this disorder. I will be talking on three major regions now. I'll be talking on the prefrontal cortex, I'll be talking on the amygdala, and I'll be talking on the septum pellucidum. First of all, to start with, what is the prefrontal cortex? The prefrontal cortex, according to Ramsau, is actually the largest part of the cortical area of the brain. It is said to assume at 29% of the whole cerebral cortex, and it is located right anterior to the premotor area. So the prefrontal cortex actually has different parts. It has a lateral part, a medial part, and the orbital prefrontal cortex part. While the lateral part is divided into two, which is the dorsolateral and the ventrolateral, which are comprised of both Bosman's area 8, 9, 10, 44, 45, 47, and 46. That is for both parts, both the dorsolateral and the ventrolateral part. While the medial prefrontal cortex consists of areas 8, 9, 10, and 12. The orbital prefrontal cortex consists of just three Bosman's area, which are 11, 12, and 13. Out of all these parts, I will be making emphasis on the orbital prefrontal cortex, and the lateral part because of the uniqueness of the two, because of the uniqueness of two Bosman's area that can be noticed there, which are for the orbital prefrontal cortex, Bosman's area 11, that is responsible for processing emotions and values, and Bosman's area 47, that is responsible or that functions in feeling empathy. So Rain two, in 2000 discovered that for the prefrontal cortex, there is an obvious, let me not call there is an obvious reduction in the gray matter area that can be found there. And this is after a brain imaging, Jiang and Rain in 2009 rather. And this is after a brain imaging an MRI imaging of an individual with, so a set of individuals with the disorder and set of individuals that doesn't have the disorder, they notice reduced function and structure in those areas, and they notice at least 11% decrease in the um gray matter area of that side of the brain. And oh, I did not talk about the function of the prefrontal cortex. Why is it unique? Why is it that reduction in this part cause, we affect or cause an effect in people with antisocial personality disorder? The main function of, or the vital function of the prefrontal cortex is thinking, reasoning, conforming to learned social rules, decision making, self control, and so on and so forth. So, the reduction in this structure and this function can lead to the obvious impulsivity that can be noticed among people with antisocial personality disorder, and it also leads to their inability to carefully reason before acting. So they are so impulsive that whenever just a slight touch will trigger them to act, something that a normal individual take might think about twice before doing. Before you know it, they're on it. They're already acting. So that explains their impulsivity and their lack of fear. So the obvious reduction in the structure and the function explains that. The next word that I will be talking about is the amygdala. Yeah, thank you. The amygdala is an almond-shaped structure in the brain that is located deep and medially to the temporal lobe of the cerebellum. The function of the amygdala functions in emotional responses as well. Emotional responses like fear and emotional responses like anxiety and so on and so forth. So Sueda et al. In 2022 found out that the hippocampus and the amygdala volume of people with antisocial personality disorder is reduced compared to those that are also healthy. And that explains their lack of fear. Also, sorry for going back, before the reduction in those areas, in the reduction in the prefrontal cortex of people with antisocial personality disorder, and because it affects the Bodmer's area 47, also explains the lack of remorse that can be seen among people with the disorder. So thank you very much. Can I push it back to the front? The next slide. Okay, thank you. So the Sueda et al. No. The one before. Thank you. Sueda et al. Noticed from observation, brain imaging, and so on and so forth, also noticed a reduction in the amygdala, and both in the structure and the functioning. And in relation to the prefrontal cortex, the most affected area in the prefrontal cortex is actually the orbitofrontal cortex. And Craig et al. They also investigate because there's a connection between the orbitofrontal cortex and the amygdala. Both are joined together by the uncinate fasciculus. That is a bundle of myelinated nerves that joins these two sides. And from his observation, he noticed that there is a degradation of that tract as well. That is the tract joining the orbitofrontal cortex, that the prefrontal cortex, to the amygdala. And this degradation cannot only be seen in, or is not only associated with antisocial personality disorder, actually. This deviation also explains the increase in aggression and loss of fear response that is noticed among people with Clover-Bucy syndromes. So now we can see how this impairment explains some of the features that these people exhibit. So the next thing that I'll be talking on under the neurological impairment is cavum septum pellucidum. So just like a form of introduction, cavum septum pellucidum is actually a triangular double membrane that separates the right and the that separate the anterior horn of the right and left lateral ventricle from each other. So it appears during the 12th week of gestation. Then after the 12th week of sorry, it appears during the 12th week of gestation. Then after birth, 3 months or 4 months postnatally, that septum, that space is supposed to close. And the persistency of that space to occur after this period of time leads or affects the development of the limbic system, which amygdala is also a part. So actually, carbon septum pellucidum is a marker for um, maldevelopment of the brain. So I just want to explain how that can be, how that carbon septum pellucidum can be associated with antisocial, antisocial personality disorder now. Being a marker to maldevelopment of the brain, individuals, according to Rain in 2010, from his findings, discovered that individuals with carbon septum pellucidum have been found to have higher scores on antisocial personality disorder, psychopathy, and other criminal behavior. And that is because the persistency of that space affects the development of the limbic system, which indirectly affects the indirectly also affect the development of the amygdala, which explains which I've explained before, affect or leads to some of the signs that are seen among people with antisocial personality disorder. Next slide. Etiology of antisocial personality disorder. The main etiology of antisocial personality disorder is not known, but there are factors that contribute to it. Factors such as genetic factors or biological factors and environmental factor, which in the next slide I'm going to be explaining how these two can come in together. Next slide. Genetic basis of antisocial personality disorder. There are a lot of genes actually that are associated with antisocial personality disorder. Scientists are still working on a lot of different other genes, example SNAP25 protein and so on. But in this presentation, I will be talking on a common gene. I believe this gene is very common. Almost everybody should know about it, and that is the monoamine oxidase age gene, MAOA gene. So the MAO gene is a gene that secretes, it helps in the secretion of monoamine oxidase enzyme that helps in breaking down uh, monoamine neurotransmitters and so on. For example, dopamine, serotonin, and norepinephrine. So the low activity of this gene, according to Caspi et al. In 2002, the low activity of this gene can be noticed to also cause antisocial personality disorder, whereby we all know this gene. Some call this gene warrior gene, the so some call this gene the warrior gene, and is usually or very usually associated with what's it called? Usually associated with psychopathy. Yeah. So it's usually associated with psychopathy. So breakdown, when there's a low activity of the gene, that will in turn cause a decrease the um in the amount of serotonin present in the brain. So, and that's I will explain later how that also contributes to the things or the signs that we see among people with antisocial personality disorder. So, it was discovered by Caspi to other individuals or children with low activity of this gene when beaten, when abused, whether physically or sexually, can trigger them to act or can trigger them be to behave like a psychopath, basically, like can trigger criminal behavior from them. So that is how this gene is related, although it was still discovered that later about 20% of, so it was still discovered that people with this gene, even without without abuse and so on, they still have the tendency of expressing these antisocial behaviors. So, but then environmental factor comes in when abuse of people with low activity of MAA gene, abuse on them will result to them will triggers criminality behavior in them. So that is where the environmental factor also comes in. So this next slide. Hormonal changes that can be seen among people with antisocial personality behavior. So I'll be talking on the serotonin at first. So serotonin is a neurotransmitter that has been associated with antisocial personality behavior, and it is responsible or involved in the regulation of many behaviors or psychological processes, including mood, perception, anger, aggression, and so on and so forth. So low, sorry, so low amount of serotonin or low level of serotonin in the body is as in the brain is associated with impulsivity and inhibit sensible behavior. And one of the things that can cause low level of this neurotransmitter in the brain is low activity of MOH. So we can see how that correlates now. So this next slide. Testosterone. Testosterone. Okay. Testosterone is a common hormone. It's a product of HPG axis, also called HPG axis, called hypothalamic pituitary gonadal axis, which an increase in this hormone is generally associated with aggressive behavior and dominant behavior, and which explains when there is an hypersecretion of this hormone or an hypervolume of this hormone in the body also explains the aggressiveness that people with antisocial personality behavior has. So the testosterone level of people with antisocial personality behavior is higher than the testosterone level of people with of people without antisocial personality behavior or people without antisocial personality disorder. So, and inverse of that is corticosteroids. That is next slide. That's the next slide. Yeah, no cortisol. People, cortisol are stress regulators. So when we are passing through a phase of anxiety or we are afraid of one thing or the other, we generally like have an increase in the secretion of cortisol in the body, just to calm, our body and to reduce the level of stress we are putting on ourselves. Whereas people with this disorder don't have, or they don't witness that kind of stress level. So they normally tend to have a low level of cortisol, baseline cortisol. That is, how will I explain baseline cortisol now? Like if on a baseline, yeah, baseline cortisol level, that is when you are not even passing through anything at all, you will measure your cortisol level and their cortisol level, yours will be higher. I mean, for people without antisocial personality disorder will be higher than those without those with antisocial personality disorder. So they tend to have low level of baseline cortisol level, low baseline cortisol level compared to people with and people without antisocial personality disorder. This next slide. Okay, so in conclusion, I think I omitted that from the slide. In conclusion, we have seen how the different signs, we have seen how the different signs that are exhibited by people with antisocial personality disorder can be explained by the neurodevelopmental or the neuro impairments that are found in them, and that explains the reason why. And yeah, and that explains the reason why antisocial personality disorder is a neurodevelopmental disorder. It's also a neurodevelopmental disorder because the onset of antisocial personality disorder can start as early as childhood, childhood developmental stage, and that is from 3 years and above. So they don't actually like, it's not like, okay, during the phase of their life, they just encounter a disease or an immune disorder, so a disease or anything that just tamper with their brain. This is something that if you ask anybody with this kind of disorder, they will tell you, this is how I am, this is how I've been. They don't know how to live their life other than the way they have been living it. So some of them, or most of them, don't actually know that they don't actually know that there's something wrong with them. And we also don't know that there's something wrong with them because majority of people are not aware probably about how, okay, this disorder can be, they are not aware about how the disorders can be explained. They don't know how it works, so they just feel like, okay, maybe this is how this person is. Actually, if a lot of people have the understanding of this disorder, I'm very sure the 40 to 60% of people that are in jail right now with the disorder will not have been in jail, because putting them in correctional centers like jail will not change who they are. When they are done serving their sentence, they'll come back to the society and continue living their life as usual, because that's the only way they know how to live their life. They don't know there's anything wrong with them. So if people are aware of this disorder and a lot of other disorders like this, instead of putting them to jail or a correctional center like that, a harsh correctional center like that, it would be more advisable to put them to the care of a psychiatrist or a psychologist that will help them trace their step through different therapies and so on and so forth. And that will cause a positive change in their life. So a lot of people have been harshly dealt with without knowing the reason, or without bothering to investigate the reason why they are acting the way they do. For normal individuals and healthy individuals who think it is unreasonable, but for someone like them, I bet you that is like the most reasonable thing to do. So last 2 years, Just I was reading an article concerning criminality and so on and so forth. Then I got to know about this disorder, and I got to do my findings, do my literature review on it. And then I realized there are a lot of people that have been suffering actually, and we are hoping for positive change by sending them to such correctional centers like jail, whereas there's nothing that will come out from it. It's not surprising that about a lot of people will go to jail, be released, and most of them will still go back to doing what they used to do. That is because they don't understand that whatever thing they are doing is that wrong. They just feel like that is how I'm supposed to do my thing. So that was what actually motivated me to to study more about this disorder. And I tried to talk to some of my friends as well. And then I started working on some things like this past year, since last year rather. We started working on some things like this, pick up different strain disorders, because it is not until we what's it called? It's not until we discover a vaccine before we can call ourselves scientists. We also have social issues around us that needs to be dealt with, but majority of people don't see it that way. By dealing with those social issues, that will create a more healthy environment for everybody to live, and that way, as scientists, we'll be able to help a lot more other people. So thank you very much for listening. I really, really, really appreciate. Thank you. So do you guys have any question, please?